A stroke happens when part of the brain runs out of blood and starts to die. Strokes are so serious because a stroke can steal movement, speech, vision, sometimes forever. The damage caused depends on time. The faster treatment starts, the more brain is saved. Time equals brain. There are two main types of stroke: the type due to blocked blood vessels or the one due to bleeding in the brain. This video is about ischemic stroke, the blocked vessel stroke. The early goal of treatment is simple: restore blood flow as fast as possible. The first few hours matter. Stroke treatment works best in the first few hours. Every minute counts. Doctors may give a drug called TPA to dissolve the clot. It is also called a clot buster. TPA breaks up the clot, blocking blood flow to the brain. TPA works best when given early. The longer you wait, the less it helps. TPA has risks. It can cause bleeding in the brain, but early treatment usually saves more lives. Newer drugs like tenecteplase are being studied and may work even faster. In the case of mechanical thrombectomy, some clots are removed using tiny tools inside the artery. Doctors thread a catheter to the clot and pull it out. Thrombectomy helps most when large brain arteries are blocked. Regarding the time window for thrombectomy, it is best within 6 hours. It is sometimes helpful up to 24 hours. These treatments require special stroke centers and expert teams. If TPA isn't possible, doctors often give aspirin within 48 hours. Aspirin doesn't remove clots, it prevents new ones from forming. We will now consider other antiplatelet drugs. Some patients use clopidogrel, dipyridamole, or cilostazol. Blood thinners don't thin blood. They just make clots less likely to form. Blood thinners are used for strokes caused by heart rhythm problems. Irregular heartbeats can send clots to the brain. These patients need anticoagulants. After a stroke, the long-term goal is prevention. Stop the next one. High blood pressure is the biggest stroke risk. Controlling it saves lives. High cholesterol raises stroke risk. Statins help lower it. Low-dose aspirin can prevent future strokes in many patients. Sometimes doctors use aspirin plus clopidogrel for the first 90 days after a stroke patient is successfully treated. Using both of these two drugs long-term raises bleeding risk without extra benefit. Lifestyle changes save brains. Medication helps, but lifestyle matters too. Smoking damages blood vessels and multiplies stroke risk. Quitting helps immediately. Eat more fruits and vegetables. Less salt, less processed food. Even walking daily improves blood flow and brain recovery. Some strokes come from blocked neck arteries called carotids. Doctors may remove plaque to restore blood flow and prevent future strokes. Sometimes a stent is placed to keep the artery open. Many deaths after stroke come from complications, not the stroke itself. Limited movement raises the risk of dangerous leg clots. We can prevent leg clots using early movement, compression devices, and low-dose blood thinners. Stroke can affect swallowing. This increases pneumonia risk. Food or liquid can enter the lungs without warning. Some patients need temporary feeding tubes while healing. Bladder problems are common after stroke and need monitoring. Up to 70% of patients develop heart rhythm issues after stroke. Pressure sores can occur too. Not moving enough can damage skin and cause infections. Weakness and balance problems make falls common after stroke. Falls can be prevented using balance training, good lighting, and removing loose rugs in the home. Depression is common after suffering a stroke. Feeling sad after stroke is normal. Help is available. Most recovery happens in the first 3 to 6 months. Stroke is a race against time. Early treatment saves brain. Know the signs, act fast. Stroke is a race against time. Minutes decide memory, movement, and life itself. If this taught you one thing, hit like. It helps this message reach more people. Share this video widely. You might save someone's brain. Subscribe and turn on the notification bell so you never miss life-saving knowledge. And drop a comment below. What was the most important thing you learned today? Because when stroke strikes, knowledge isn't power. Speed is survival. Thanks for watching. I will see you in the next video.